for her 5 minutes of questioning.
Thank you, Mr. Chairman, and congratulations on ascending to your new role. I know this subcommittee is in capable hands. And I want to say, as someone who has been on this subcommittee my entire time in Congress, we've spent a lot of time over the years looking at the organ donation rules and practices, and it's really shocking when something like this happens with all of the effort that Congress has put in, and I know agencies like yours as well. Last year, there were more than 48,000 transplants performed in the United States, but right now, there are more than 103,000 people on the national transplant waiting list, and tragically, as you know, Dr. Lynch, about 4,700 patients die every year while waiting for organ donation, and so there's an incentive to find more organs, and it's a you know, it's a life-saving thing if it's appropriately done, if the person wants to donate their organ, and if in fact they're dead, and in fact if it qualifies. That's something we all agree with, and I'm hoping everyone on this subcommittee has checked yes for organ donation. But it's horrifying to everybody to see some of these practices that are being used. And the New York Times has been, in the last few weeks, doing some very good investigative journalism around this practice of circulatory death certification. And there was just an article dated July 20th, updated today in the New York Times about this practice. Mr. Chairman, I ask unanimous consent to put this article in the record.
So ordered.
So what they talk about, and Dr. Lynch, you talked about it a little bit, is the increase in the circulatory death process is part of what has led to this problem, because in a rush to get the organs, then many of the providers are saying that this is putting pressure on them to certify death when in fact the person may be even moving. And I'm wondering if you can talk about that just briefly.
So to be clear, the certification of death is by the donor hospital, not by the OPO. But with regard to what I believe your question is there increased regulatory oversight in the performance of OPOs that they're required to perform similar to their peers? Is that leading to a rise in these events?
Yeah, but the hospitals feel that they're being pressured by the OPOs to certify death. That's what's stated in these articles and by the investigations.
So my understanding of that article was that the hospitals, some hospital staff were recorded as saying that the OPOs were more present in their hospital.
That's correct.
Yeah. So OPOs are recovering more organs than ever before, and that is a multifactorial thing. Some of it is related to increased oversight by CMS. Some of it is related to new technologies. Some of it's related to the ongoing opioid epidemic. The increased emphasis on performance in any area of medicine is never an excuse for noncompliance.
That is correct. I want to ask you about the structure, because the OPTN board has recently been restructured, but previously the board of directors of UNOS, which was the sole contractor, was also the board of directors. And you said in your written testimony that this governance structure created a potential conflict of interest, and that goes to what I'm talking about. And so I'm wondering if you can explain the conflicts of interest as we're trying to do this oversight over these new emerging trends.
So NOTA at its time was a wise piece of legislation, but over time it has shown its flaws. NOTA basically told HHS to build a house for transplant. And it said you can have one contractor, and that contractor is your architect, your builder, and your home inspector. HRSA was in the position of being across the street and wasn't able to directly oversee those functions. Having a contractor's board also be the board of the government entity, there's no way in which it will not affect the objectivity of that board.
It's almost a per se conflict of interest, is that right?
Yes.
And so does HRSA have a written plan in place to make sure that we have continued safeguards against potential conflicts of interest and make sure this board remains truly independent going forward?
Yes, so HRSA this spring created a new board of directors, and that was done through a special nominating committee, what we call the Transition Nominating Committee. They identified individuals who were volunteers coming forward from within the community. They identified a list of criteria to screen them for potential conflicts of interest, including service on the board within the last 10 years during the period of most concern. And from within a group that passed that conflict check, the community elected a new board.
Thank you. I yield back.
Gentlelady yields. The chair recognizes the gentleman from Alabama, Mr. Palmer, for his 5 minutes of questioning.